Hello everybody, welcome to today's update. I will start with the usual update on the COVID statistics. I can tell you that an additional 44 positive cases were confirmed yesterday, which is 0.8% of people newly tested, and means that the total number of cases now is 19,921. The full Health Board breakdown will be provided later. My provisional information is that 7 of the 44 new cases are in Tayside, where of course we're dealing with the cluster involving the Two Sisters food processing plant. I can also confirm that a total of 243 patients are in hospital with confirmed COVID, which is 5 fewer than yesterday, and 1 person is currently in intensive care, and that's the same as yesterday. Again, in the past 24 hours, no deaths were registered of patients who had tested positive in the previous 28 days for the virus, which means that the number of deaths under that measurement is still 2,492. This week's more comprehensive figure, which includes deaths where COVID was either confirmed through a test or presumed, will be published by National Records of Scotland tomorrow. These figures obviously continue to be a stark reminder of the impact that COVID has had, and again I want to express condolences to everybody who has been bereaved as a result of it. And again today my thanks go to everyone who is working hard in a whole number of different ways across the country to help us through this difficult period. There are 3 issues I want to cover today. Firstly, I'll give just a bit more detail on the main clusters that we are dealing with right now. In Aberdeen, there are 261 cases associated with the cluster linked to pubs in the city. That's an increase of 2 since yesterday, but it's worth noting that one of those cases had already been reported, but has only now been linked to the original cluster. These figures generally point to the good progress that has been made in containing this outbreak, and I'm very grateful to everyone in Aberdeen for their patience and their compliance with the restrictions that have been in place. In relation to the outbreak linked to the Two Sisters plant in Cooperangus, as of yesterday, there were 152 positive cases linked to it. 134 of those were workers at the factory and 18 were contacts of those workers. The process of contact tracing there continues, and so I would expect that we'll see these numbers rise a bit more in the days to come. Just to give you some context, over the past 6 days, the mobile testing unit at the Two Sisters plant itself has tested more than 900 people, and other testing sites in Dundee, Forfar and Perth have between them tested more than 2,500 people. And the bit I want to stress, although I would repeat that we're not complacent about this, but at this stage there is still no evidence of wider community transmission from this outbreak, and that of course is positive given the scale of the outbreak that we have been dealing with. I want to thank everyone who's involved in managing it. It's a huge amount of work that has been done. And let me thank also employees at the factory and their households who of course are now self-isolating. And let me stress how important it is that people in those households do self-isolate for the entire period advised, and that is until Monday the 31st of August. I can understand that there will be a temptation to nip out, maybe to go to a shop or to see other people, but please do not do that. Even if you have had a negative test in the last few days, it is still possible that you could still develop and spread the virus. So please follow all of the guidance and stay at home. It is because people are complying with that so far we are managing to avoid this outbreak seeping into the community. So please bear with it and stick with it so that we can continue with that success. Finally, there are a number of cases, not least in Lanarkshire, involving individuals who attend schools. The health protection teams locally are dealing with all of these cases. Where necessary, they have and will continue to write to parents and carers of children in relevant classes, advising them that their children should self-isolate. I want to stress in relation to all of these outbreaks that we're dealing with just now, and indeed the situation with schools, we're not unduly concerned by any of these situations right at this moment. That said, we're not complacent either. As you will appreciate, we continue to monitor all cases, clusters and outbreaks very, very closely indeed. The second issue I want to talk about today concerns some issues that people have been having over the last day or so in booking tests through the UK-wide booking system. Over the weekend, there was a major spike in demand for testing, not just in Scotland, but we think across the UK. And that led to some constraints on the booking portal throughout the day yesterday. And that in turn resulted in a surge of calls to our COVID-19 helpline. I know this will have been frustrating for people trying to book a test. I want to thank everyone for bearing with us as we've worked to address these issues, and I want to just run through some of the work that is being done to do just that. Now, some of what I would describe as technical issues, for example, people in Scotland being offered tests at centres outside Scotland, are being resolved. That shouldn't be happening. Where any technical issues do arise, as unfortunately with a system of this scale and complexity might sometimes do, we will endeavour to have those sorted as quickly as possible. On the issue of capacity, though, which is the more significant issue, we've always known that there will be fluctuations in demand for testing. That's why we have contingency plans in place, and these contingency plans are already, as we speak, being activated. For example, over the course of this week, we will be deploying 3 additional mobile testing units across the central belt of Scotland. The first of these will be operational in Glasgow today, this afternoon, and the other 2 will be operational later this week. In total, they will increase capacity by around 1,200 to 1,500 tests every day. We're also, over the course of this week, further increasing the number of tests that can be carried out at the regional testing centres across the country. And we are also utilising additional NHS testing capacity. For example, NHS Greater Glasgow and Clyde will be activating drive-through facilities to help manage demand in their local area. In the more medium term, but already this is work that has been in process, we are also establishing 11 local walk-through testing centres. The first of these will be housed in the Victory Memorial Hall in St Andrews. And together, they will help to increase sampling capacity by more than 3,000 tests a day. So we will continue to implement these plans to further increase capacity as we head into winter, as we have always been preparing to do. But we'll also continue to work to ensure appropriate contingencies are in place for periods when we have higher than expected demand for testing, which is likely to happen as we go into winter. But at any point, if there perhaps is another virus circulating, a cold that is leading perhaps in particular to children having symptoms similar to COVID, then we know we will see these spikes in demand, and that's why we need to have these contingencies in place to deal with them. But let me take this opportunity just to remind everyone that you should only book a test, either for yourself or for a family member, if you or they do have one of the COVID symptoms, a new persistent cough, a fever, or a loss of or change in your sense of taste or smell. The exceptions to that general position of only booking a test if you have symptoms are firstly, if you are advised to do by Test and Protect. Sometimes Test and Protect will advise people who have been contacts of confirmed cases but who don't have symptoms to go for a test. And secondly, if you work in a profession with agreed access to testing, for example, staff working in schools. But otherwise, only book a test if you have one of the symptoms that we often and regularly remind you of. Now, the third issue I want to cover today is the use of face coverings in schools. As I said yesterday, our scientific advisory group has been looking closely at this issue, particularly in light of the new World Health Organization guidance, which was published at the weekend. As a result of that work, the advisory group has recommended changes to our current guidance in Scotland. Their recommendations are based on the latest scientific evidence, as well as the real-life experience of schools since they reopened a number of days ago. And the Scottish Government, in consultation with the Education Recovery Group, has now agreed the changes proposed. It's possibly worth just reminding people of what the current guidance says before I set out what the changes to that are. In general, the current guidance advises that face coverings in the classroom are not necessary. However, it says that staff should wear them if they can't physically distance and are having face-to-face interaction with pupils for more than around 15 minutes. The guidance also currently emphasises that staff and pupils should be supported to wear face coverings if they wish to do so. That advice remains unchanged. However, the new guidance will now include 2 additional situations where face coverings should be worn. Firstly, as I indicated yesterday, adults and pupils in secondary schools should wear face coverings when they're moving around school in areas where distancing is challenging, for example, through corridors or in communal spaces. And secondly, adults and children aged 5 and over should wear face coverings on dedicated school transport. And that, of course, simply now mirrors the situation on public transport more generally. Now, in both of these situations, there is a greater potential for different groups to mix. There is more chance of voices being raised, resulting in the creation of aerosols. And of course, there's less scope for distancing and effective ventilation. So we believe that face coverings could provide an additional layer of protection in mitigating these factors. The guidance will also emphasise how face coverings can be used to address specific issues, for example, where there is a concern about a particular school or where there is an outbreak or greater transmission in a particular area. All of these changes will apply from next Monday, the 31st of August. Before then, schools will be expected to provide pupils with clear instructions on the use of face coverings. We expect that most children and young people will have access to face coverings already as part of their daily lives. However, we will work with local authorities to ensure that schools also have supplies so that no child is disadvantaged. There are, of course, people for whom wearing a face covering is not appropriate, which is why there are already exemptions in place for individuals with breathing difficulties or certain disabilities when it comes to wearing a covering in places like supermarkets. So there will also be young people for whom it's not appropriate to wear a face covering in school, and schools will of course discuss that with pupils and parents. But let me be clear that nobody should be stigmatised in a school because they cannot, for one of those reasons, wear a face covering. We hope that these changes provide some additional assurance to pupils, staff and parents. We know it's not easy. None of what we're all having to live with right now generally or in schools is easy, but it is all about trying to minimise the risks of transmission, and we will of course continue to keep the guidance under review. I want to emphasise though, and this applies not just in schools, it applies more generally, face coverings are just one additional layer of protection. They are not a substitute for the other things we're asking people to do. All of the other safety measures, good hand hygiene, regular cleaning and where possible in schools physical distancing remain vitally important. Of course, as I said, that applies not just in schools but to all of us. So to close today, I want to just quickly remind everyone again of the key public health guidance. We know indoor transmission is a risk. We've always known that, and we see the evidence of that coming through our data right now. So can I take the opportunity to remind everybody that when you're indoors, no more than 8 people from a maximum of 3 households should be meeting up. And that applies whether you're in somebody's house or in a pub, a bar or a restaurant. You should at all times physically distance from members of other households and remember to wash your hands and hard surfaces. All of this, if we all follow these rules, it minimises our chances of getting the virus, and it also minimises the risks of us passing the virus on to others. And as I said yesterday, and it's worth everybody bearing this in mind as Test and Protect operates around the country, if you follow all of these rules, particularly around physical distancing, you are less likely to be a close contact of someone with COVID. So you're less likely to get that call from Test and Protect advising you to self-isolate for 14 days. Let me absolutely bring my remarks to a close now by just reminding everybody of the facts, rules, the 5 golden rules that everybody must follow to try to keep this virus under control. Face coverings in enclosed spaces, avoid crowded places, clean your hands and hard surfaces regularly, 2-metre distancing remains the overall rule, and self-isolate and book a test if you have symptoms. Thank you once again for listening today. I'm going to go straight to questions now, and of course I'm joined by the Chief Medical Officer who will assist me with the answering of questions. First question today is Jamie McIver from BBC Scotland.
Good afternoon, First Minister. First of all, on face coverings in schools, what steps can be taken to ensure that students put on their face masks correctly and wear them correctly so they don't risk doing harm as well as good? If I may direct this point to the Chief Medical Officer, Given the Public Health Scotland figures, which show a big rise in the numbers waiting more than 12 weeks for treatment and more than 6 weeks for diagnostic tests, how worried are you about the indirect effect of COVID on public health?
I'll hand over to the Chief Medical Officer on that point since you've directed it to him. On the first part of your question on face coverings, we don't underestimate the difficulties for everybody right now in getting used to living in these very different ways. And that, I think, is particularly difficult for young people who don't want to have their lives inhibited by face coverings and constant, reminders to wash their hands. But it is really important. So we will continue to try to address this on a number of levels. We'll continue to provide as clear guidance as possible on the do's and don'ts of wearing face coverings. We'll continue to stress, as I've just done, that it's not a substitute for the other measures we're asking people to follow. It's an additional layer of protection. And of course, schools, and it's not easy for schools, for teachers and support staff, but schools have a role to play here day to day in helping young people understand when they should be wearing their face coverings and how they should be doing that appropriately. These are things that all of us need to be prepared to potentially live with for quite some time. So there's a real merit in all of us just getting used to the things that we should be doing and shouldn't be doing and the right and wrong ways of doing that, because it is likely that some of these measures will be in place for quite some considerable time. But we'll continue to provide as clear and as concise guidance to people as we possibly can.
Thank you for your question. I think it's a really important question to ask, and all through the response to the pandemic, one of the things that we have been doing is balancing the potential harms that exist in the system in terms of how we shape that response, so that we're not dealing with just the direct harms caused by COVID-19 as a disease, but also the needs of the population from other reasons as well. So we've been looking very closely, examining the data all along, working with clinicians to make sure that those with the most urgent need were prioritised. And as we're remobilising the NHS again, we're making sure that it's a very clinically led decision making that examines how we sequence patients in terms of their returns to treatment. I guess what I'm also keen to emphasise in response to your question is the role that patients play in all of this as well, and making sure that if you have symptoms you're worried about, is that you are not simply kind of ignoring those, sitting on them at home, waiting for things to get better. If you're worried about your symptoms, I would far prefer that you were seeking some advice from your clinicians in relation to those. So making sure that just in the way that you would in the past, you're accessing services, to talk over your services, so that those can be taken into account, and so that that can be prioritised as we start to remobilise the NHS and make sure that people are listed for treatment according to their clinical need.
Thanks. Kay Nicholson from STV.
Thank you, First Minister. You say schools have a part to play in instructing youngsters to, effectively put on, remove, and also store face masks. But is there not a risk of this adding yet more to teacher workload at a time which has already been reported by EAS and others as a very challenging time for school staff? And also, how can the use of face coverings be policed when you've already ruled out, expulsions, for example, as disciplinary action for not complying?
I don't underestimate, how challenging it is for teachers to be doing their jobs right now, already difficult jobs, in this environment of having to be mindful of all the different mitigating measures to keep COVID under control. And obviously we're talking about schools and teachers here. They do a very challenging job in the best of times, but many people across different sectors and different professions are having to deal with similar challenges right now. It's not ideal. I really wish we weren't having to do it, but it is all about trying to put in place as many mitigations as possible to keep COVID under control, because it's only if we keep COVID under control that we can have children back in school, which I think we all see as really, really important for their education and well-being. But it's only if we keep it under control that we can see the economy and society operate with some degree of normality again. So these are all huge inconveniences in our day-to-day lives. Nobody, least of all me, is going to stand here and pretend otherwise, but they are necessary inconveniences right now for protecting health and well-being, and trying to protect that ability of all of us to live with some degree of normality. On the issue of guidance and policing, when we're talking about children in schools, schools are, and as you say, the teachers do a tough job, but schools already have behaviour policies, in place. They already, try to encourage young people to do the right things, dissuade them from doing the wrong things. This is another aspect of that, but it, in my view, is much better that it is done in that way, where young people are, it's part of the process of young people understanding what we all have to do right now to keep transmission as low as we can. I don't think it would be, we don't rule anything out when it comes to dealing with COVID, but ideally we don't want to have an enforcement regime around this kind of guidance in schools, and that's why I think it's best dealt with through the normal processes that schools will have in place. Tim Batshaw from ITV Border.
Thank you, First Minister. I'd like to ask about the arts sector, theatres, live music events and the like, which have suffered so badly during coronavirus. One MSP in the south of Scotland says there's likely to be a jobs crisis because of all this. I know you've given a lot of support already, but is there an argument for giving more support to this sector as it struggles to get back to normality? And also, is there a case for looking again at the 2-metre rule inside small theatres, for example, to make them viable, as you have done in restaurants and pubs and the like?
We will always look at the practical arrangements to try to make businesses as viable as possible, but this is always a balancing act. If we go too far and the virus starts to transmit again, then the danger is we end up with these different settings closed down again, not operating with a 2-metre rule. So this, I'm afraid, is just a difficult juggling act as we go through this. And we will listen to arguments and cases that are made by different sectors. But we know that in the hospitality sector, we're having to have other mitigations in place if there is an exemption to 2 metres. So often this is, what you gain in one way, you perhaps find it more difficult in other ways. So there's very difficult conversations and judgments to be made around all of this. So I don't rule anything out, but equally I can't always rule these things in without some careful consideration. On the financial question, we will always look at what more we can do. We're looking, around culture generally just now. There's, case, I think a case being made, for example, for comedy within culture, although comedy is not excluded from the other support streams that are there. So we will always look at what more we can do. I don't mean this to sound as an excuse or a political point in any way. It's just a statement of fact that the Scottish Government's resources are finite because we don't have access to unlimited borrowing powers the way the UK Government does. So we come to a point where we just can't do any more because we have no more financial flexibility to do it. So that's why inevitably in these discussions we do also have to look to the UK Government, which holds the borrowing powers, and I would continue to make the case to them to not end the furlough scheme in October. Countries elsewhere are extending their job retention schemes for a much longer period, and I think the biggest looming threat of a wave of redundancies is the premature ending of the furlough scheme. So I would encourage them to think again about that, and also encourage them to look at how we can have greater flexibility to help different sectors over and above that. Now, that could either be spending decisions on the part of the UK Government that feeds into additional resources for the Scottish Government, or giving the Scottish Government greater fiscal flexibility to allow us to make those decisions ourselves. So these conversations are not easy, but they will continue because there are going to be many businesses that will require ongoing support while we continue to try to get through the implications that COVID presents for us. Joe Pike from Sky.
Good afternoon, First Minister. For months, we've been told that there was a 4 nations approach to COVID-19, and that certainly seems to have ended in terms of masks in schools with different rules for kids in England and Scotland. Firstly, why do you think, First Minister, you are right and the UK Government is wrong? And to the Chief Medical Officer, what is the evidence on compliance, whether kids will actually follow the rules? Certainly the UK Government have suggested that the evidence for under 15s actually complying is limited.
There is a 4 nations approach to COVID. We cooperate, we share our thinking on things and where it is appropriate. And and necessary, we take decisions in concert. But health and health protection is also largely a devolved matter, so it's my responsibility and my duty as First Minister to take decisions that I judge are the right decisions to protect the Scottish people. That is the nature of devolution, and on some things we've taken a slightly different approach. Sometimes that's only been for a period of time, and the government that has taken a decision first has been followed at some stage by other governments. We'll see if that turns out to be the case on face coverings in schools. And I'm not going to stand here and say I'm right and somebody else is wrong. We're all making really tough judgments here. I've got a responsibility for Scotland to make those judgments in the best way I can, taking account of the evidence and the advice and applying my judgment to them, and that's what I will continue to do. I'm not going to criticise leaders of other governments that take different decisions, because it's for them to set out the reasons for the decisions they take. We're all trying to do our best here to get through an unprecedented and really difficult decision. I think face coverings, we mandated face coverings, I think, in shops earlier than England did, but England later followed suit. We try to follow the best advice. The WHO have updated advice on young people over 12 wearing face coverings over the weekend, and I think it is right that we reflect that in our guidance. But none of these things are ever absolutely clear-cut. There's always, for every argument for something, somebody will make an argument against it, and we've got to take the overall view, and my overall view is that face coverings in certain circumstances provide an additional layer of protection. And given how important it is to try to keep schools open and keep schools open safely, I think it's the right thing to do.
So when we take decisions like we've taken today to introduce face coverings into the school environment, it's all about assessing the balance of risks, and essentially compliance is part of that process as well. I want to emphasise at this point that the introduction of face coverings should not be seen as a replacement for some of the other measures that are recommended in schools, and particularly in terms of social distancing, where there is overwhelming evidence that actually maintaining distancing of at least 1 metre is beneficial, and that we should try to continue to do that even when people are wearing face coverings. So it's not a replacement for that, it's an additional measure in relation to that, recognising all the circumstances. We know that 1 metre is good in these circumstances, and 2 metres where that's able to be achieved is even better. So that's the kind of environment that we're bringing that into. And when we're trying to achieve compliance in that environment, one of the things that we've got to be able to do is to be able to convince the people who are asking to wear face coverings that it's the right thing to do. And that's about making sure that we have the right type of educational message to explain exactly why face coverings are beneficial. And the evidence suggests that there is now a balance of the kind of worldwide data that in this kind of age group, the wearing of face coverings not only protects those around you if you are symptomatic or pre-symptomatic in particular, but actually might also reduce your chances of getting infection from other people through aerosol generation or people becoming too close to you, speaking with loud voices and so forth. So the message that we have to really kind of get across to the people we're asking to undertake these measures is that this is a benefit not only to you but to your classmates and also to your families back home as well.
Alan Zazinski from Global.
Thank you very much, First Minister. This face covering guidance means pupils should be wearing coverings in corridors as they're moving from class to class, then taking them off in classrooms. That could be 4 or 5 times a day in the communal areas too. Because of what we know about not taking coverings off and then putting them back on and off without washing them, does this mean pupils should be taking quite a few coverings with them into school every day? And I know you mentioned in your opening remarks about pupils not being disadvantaged. Does this mean we will be seeing financial support provided to parents to buy face coverings from lower income households, similar to the uniform grants maybe, or maybe disposable masks provided in schools?
We'll keep all of that under review, but let's be clear right now, even without the change in guidance in schools, there's already the law that young people wear face coverings in shops and public transport. So we would expect that young people are already getting used to wearing face coverings, but it is important, not just in terms of young people that may find it harder to access face coverings, but also, a young person might forget to take their face covering to school one morning. So I think it's going to be important that schools have a supply there that they can use for young people. In terms of the guidance for taking on and off, that's why guidance on the correct do's and don'ts is important. These are all balanced judgments, and we'll make sure that guidance is as clear as possible for people.
I know that the Educational Advisory Group considered this matter really carefully, and in their considerations they looked at the evidence for infection from removing masks on and off, and whether that was likely to play a significant component in terms of introducing the increased risk of transmission. And on balance, their assessment of that evidence was that there was insufficient evidence to kind of support that being an obstacle to introducing this.
Callum Clark from Bauer.
Good afternoon, First Minister. Radio 10 News can today reveal some workers at the Two Sisters plant in Cooperangus have broken self-isolation rules. This happened last week near the mobile testing unit, which was set up at the plant for workers only. And in a period of less than an hour last week, we filmed a handful of workers heading into a nearby supermarket, either before or after they headed in to the mobile testing unit. We've also spoken to one woman who lives opposite. She says that she's seen dozens more do the same last week. The company Two Sisters has come out and said that anyone who fails to self-isolate during the 2-week period the factory is closed will not be paid for that period. Do you agree with that step? And secondly, I know you said there's no evidence of community transmission at the moment, but what do you at all fear breaches of this nature can have an impact and potentially change that?
Well, yeah, of course I fear that if people don't follow the guidance on any aspect of this, then it will lead to greater transmission than we will otherwise have if people do follow the guidance. I mean, I've kind of stood here for the best part of 6 months now trying to get this point across. So I think it is pretty self-evident that if people don't follow the guidance, we are risking greater transmission. So that's why I encourage people, plead with people, appeal to people to follow the guidance. And I do that knowing that it's not easy. Particularly if you are self-isolating for a 2-week period and you're off work as a result of that, which is why I certainly welcome the fact that Two Sisters are paying their staff in full for the period of self-isolation. So I will continue to set out as clearly as I can the reasons why we need people to do this, because we really do need people to do this. Every time somebody doesn't self-isolate when they're being advised to, we are risking seeing that virus spread from somebody else in another household. And once that starts to happen, then that community transmission becomes a big risk. And it comes back to the central point. We all have to accept that we all have a part to play here. We've all got an individual responsibility. For some of us, most of the time that's just about washing our hands and wearing face coverings and keeping 2 meters distance. But there will be periods could be any one of us at any point where that responsibility will be a bit more onerous. It will mean self-isolating for a period, and that's really tough. I'm also really grateful to the councils dealing with this particular outbreak, Perth and Kinross, Angus and Dundee, because they have all been making sure that there is welfare support being provided to anybody who needs it, whether that's food or access to supplies, or in some cases accommodation for people who need that to effectively self-isolate. So none of this is easy, but we all need to do it. Otherwise, the ability to keep these outbreaks contained, as hopefully we are doing in Cooperangus right now, becomes much, much more difficult.
Just on the company's decision to say that they would forfeit pay if anyone was found.
Well, I hope that doesn't. The company has to take its decisions in terms of its workforce. I welcome the fact the company is paying staff. I would hope that we don't get into that situation because people understand the importance of self-isolating for the right reason. I would also say, and again, I appreciate the role of the media here, but if you are seeing evidence in an outbreak like this of people breaching self-isolation, you said last week, then I would encourage the media as well to kind of make us aware of that, make the local protection teams aware of that at the time, so that we can try to take action to avoid all of that. So we all have a part to play here. This is very different to normal things we usually go through, where literally right now we're all dependent on each other following the rules to keep all of us safe. And every time one of us doesn't, then we just increase that risk a little bit. And as Hassan from Kingdom.
Thank you very much, First Minister. You mentioned the issues with people accessing testing, and we've been hearing similar concerns in Fife today, including for teachers who've been forced to travel to Dundee. Were testing centres properly prepared for the return of schools and the inevitable rise in people showing symptoms of other illnesses such as colds and flus?
Yes, testing centres are prepared. We will always have, peaks in demand, and some of those will be more predictable than others, which is why we've got contingencies in place. The fact that over today and tomorrow and Thursday we will bring on stream an additional 3 mobile testing units, as well as increase the capacity of all of the regional testing centres, is evidence of those contingencies able to be activated in pretty short order. We're also, of course, and this has always been in the planning as we go into winter, increasing the permanent daily capacity. So the 11 walk-in centres that will be sited in different areas around the country. We've identified the first of those locations in St Andrews. Will also build that capacity and also help with local accessibility. And in addition to that, people can order home testing kits. Now, I know this comes through the UK government strand of this, and I know there have been some pressures in the last day or so, but we are advised that home testing kits remain available, and people, if they have difficulty accessing a testing centre or a mobile unit, have that option as well. So we will continue to build resilience, capacity and flexibility into the testing system as much as we can. And we will have to adapt that as we go through. We're making plans right now based on all sorts of assumptions, because that's all we can do. But we have to have the ability to flex them if the reality that we face as we go into the winter is greater. But my last point is just to repeat, again, like all of this, we all have a part to play. So teachers and people working in schools, they can access testing even if they don't have symptoms, if they fear they've been exposed to the virus. Test and Protect will advise some people who don't have symptoms to get tested. But other than these exceptions, to the general public, only book a test if you have one of the symptoms of COVID, which is a new continuous cough, a fever, or the loss or change in your sense of taste or smell. So it's important if we all understand all of that, and together with what's the most important responsibility of government, making sure the capacity is there, we'll be able to make sure that this testing system and the Test and Protect that comes in the back of that continues to work as well as it has been doing so far. Sorry, I think I missed Callum Clark from Bauer. Did I? I didn't. Neil Pooran from PA.
Thanks, First Minister. If I can return to that issue of the test booking system, I was wondering if we know how many people have requested a test as opposed to the number of tests that were actually carried out. Looking at the statistics for the daily numbers of tests, I think it was just over 12,000 yesterday, just over 18,000 on Sunday. So on the face of it, that's well within the capacity of 40,000. So I was wondering if you can maybe clear that up.
Remember that we have different strands of testing. I don't have the figures right now. These come through, many of these come through the UK government side of things. But we have around right now, and I'm quoting approximate figures here, testing capacity of about 40,000 a day. But of course, as well as people going to the regional testing centres, we also have a significant proportion of testing that is done weekly in care homes of certain hospital inpatients, and we are increasing eligibility in other ways as well. So we continue to have to match supply and demand. But in terms of, this is not about people not being able to access a test. It's about people who maybe had difficulty booking a slot yesterday, who will then have had a slot today. And as we bring the extra mobile testing capacity on stream and the other things I've been talking about, that overall capacity will increase. That's the sampling capacity. Obviously, we have the processing capacity, which is the laboratories as well, which are working well at the moment. But we can provide you with some greater figures later when we've got more statistics around that. Conor Matchett from the Scotsman.
Thank you First Minister, just returning to the walk-in centres, two questions if I may. One, where else are you thinking of putting them across the country? And secondly, I'm just curious about what the scientific advice or evidence for transmission in such centres would be, and the potential for these centres becoming a focal point for outbreaks if people are tested positive, walk through them and walk through the town on the way to get them.
Gregor may want to say a bit about that, but that is one of the issues that's been looked at very closely in terms of the planning for walk-through centres, and you know they will be designed in a way to minimise and mitigate that. But that's why perhaps we've taken a bit longer to get to establishing walk-through centres, to make sure that all of these issues are taken account of. In terms that we are still in the process of deciding the locations of these, and part of what we will be looking at are patterns of demand and also local accessibility. The first one, as I say, is in St Andrews, and obviously St Andrews is a university town as well, so that's another reason why that's an appropriate location. But we'll be looking carefully at parts of Scotland where the distance to regional centres may be longer, where it is maybe more difficult to get home testing kits quickly to people, but also we'll be looking at where the patterns of demand suggest that these locations should be. So we will make decisions on that fairly soon, because the intention is that these centres will be up and running as we go into the winter.
Accessibility is one of the important components of why these walk-in centres are being developed, and particularly for communities who maybe don't just have ready access to vehicles that can take them to one of the regional testing centres. We wanted to make sure that they were able to access testing safely, appropriately and quickly when that was needed as well. So these centres will be located in areas where that requirement has been identified. And to give you the reassurance that you would expect is that the infection prevention and control measures which are associated with these centres have been very, very carefully thought through to make sure that both the staff who work in them, but also the immediate environment around about them, are not subjected to any increased risk of people presenting for testing as well.
Thanks. Chris Musson from The Sun.
Hi, First Minister. On Radio Scotland this morning, John Swinney said the school's face covering policy is not going to be mandatory guidance, but when asked if individual heads would be okay not to make face coverings mandatory, he said no, the guidance is here to be applied in all secondary schools. So can you just clear up, which is it? Is it mandatory or not? And if it is mandatory, what can government do to force reluctant schools to adopt the policy? Because we know there are some schools who are reluctant. So could it be written into law, for example?
I think people who work in schools are probably quite familiar with the guidance. We have guidance in place. It means it's not backed up by fixed penalty notices that can be issued if people don't comply, but guidance that's in place in schools is not considered to be voluntary. It is guidance that we expect schools to follow. So that's the kind of distinction between guidance and mandatory. If you don't wear a face covering in a shop right now, you can be fined. We're not proposing that in schools, but I think most head teachers would understand that doesn't mean they don't have to follow the guidance in terms of the practice and policy in place in their schools. That's the way schools work generally around things that are advised in guidance. Obviously, we will monitor the application of that, and if we have to change that in any way, we will consider that, because we keep all of these things under review. David Ball from the Herald.
Minister, at this morning's Health Committee, the Justice Secretary said that Public Health Scotland has been unable to reach its 20% target of contacting overseas arrivals due to a lack of resources and staff, and that to do so would mean removing people from other contact tracing roles. Can I just ask how concerned you are about that situation? Are you confident enough sort of communication is taking place from those arriving in Scotland? And could more resources be made available to Public Health Scotland to employ more staff?
I covered this at some length, I think, in Parliament last Thursday during First Minister's questions. The original target for Public Health Scotland was 20% of incoming passengers subject to quarantine, up to a limit of 450 a week. And at that point, that was seen as an appropriate sample for the volumes coming in. In actual fact, Public Health Scotland have been doing more, in some weeks significantly more than 450 a week, but because passenger numbers are higher, that won't always have equated to 20%. So yes, we are looking at the resourcing of that as as international travel doesn't get back to normal, but as volumes grow again, to make sure that we've got the right capacity in place there. Obviously, as we do that, we want to make sure that first and foremost we are staffing the contact tracing operation sufficiently to deal with outbreaks. So we look at these things on an ongoing basis. But it's important to say that Public Health Scotland has been doing more than the 450 cap that they envisaged some weeks ago. Helen Puttock from The Times.
Hello, I'm just wondering if I can appeal for clarity on something that we've been trying to get a clear answer on, and that is if as a parent your child appears to have a cold, should you seek a COVID test for your child?
I'm not sure you haven't had a clear answer on this, so let me try it again and make it as clear as I possibly can. If you or your child has one of the symptoms that we think are symptoms indicative or could be indicative of COVID, you should go for a test. That is a new continuous cough, a fever, or a loss of or change in your sense of taste or smell. If you have one of those symptoms, yes, you should get a test. If you have none of those symptoms, unless you are one of the exceptions that I've spoken about already, no, there is no need to get a test. So if your child has, a bunged up nose but doesn't have a cough or a temperature, we would, and I probably should hand over to the doctor here with me, no, but if your child has a temperature or a cough or their taste or smell is affected, then yes. So it's the symptoms rather than saying, oh, it's a cold or whatever. These are the symptoms we're asking people to be vigilant about.
We're entering a time of the year when we'll start to see more respiratory symptoms becoming apparent, and that's not just going to be for children, that's going to be for all age groups. But the symptom complex that we're recommending testing for hasn't changed at all. It's still the same symptom complex we've been recommending for over the course of the summer months. It's still if you have a continuing enduring cough, if you've developed a fever, if you've developed a loss of or a change in your sense of taste or smell, those are the symptoms that we're asking you to isolate and seek testing for as soon as you can.
Thanks. Alistair Gossett from the P&J.
Good afternoon, First Minister. Just on the Aberdeen hospitality trade reopening, Aberdeen Council officials have repeatedly told business owners that they can reopen to customers tomorrow, regardless of whether they've been checked by environmental health or trading standards. They can even reopen if something has been flagged for further check-up on an earlier visit. Environmental Health have also offered to carry out some checks over the phone. May I ask if it's still the government's view that the checks should be carried out before any businesses reopen, and if you're concerned the council is straying from what was agreed on Sunday?
I've no evidence the council is, other than what you've told me there, is straying from what was agreed. They were part of the discussions on Sunday. So yes, it is the position, it's not my view, it is the position that businesses, hospitality businesses in Aberdeen should only open tomorrow if they've had the appropriate check from Environmental Health. I'm not going to tell Environmental Health officers exactly how they do their job, but that appropriate check is undertaken, and that's really important so that we know before we open up hospitality again that the right measures are in place to minimise the risks of transmission. And certainly I don't have the figures in front of me right now, but the update I saw last night suggested that the majority of those checks in Aberdeen had already been carried out and the remainder were in the process of being arranged. If you haven't had an approach from the council, if you're one of these businesses in Aberdeen, then as I said on Monday, which I think is yesterday, then get in touch with the council to arrange that as quickly as possible. Michael Blackley from the Daily Mail.
Thank you, First Minister. Some parents are quite angry about the decision today to roll out face covering in parts of schools. They also point out that there's differing scientific views on this. Can you actually, they're also concerned that it's going to be something of a slippery slope and that this could, for example, be introduced in primary schools at some point in the future. Can you rule out getting to that stage where you'll look to do that?
If I was to stand here and rule out things when we're dealing with an infectious deadly virus, then every parent in the land should be up in arms and furious at me, because that should not be the way any First Minister right now is responsibly doing her job. I'm going to children in schools, and as I keep saying, I'm not a parent myself, but I've got a niece and nephew at secondary schools who'll be affected by this. I know anything to do with children is very emotive and very sensitive. We're trying to take the best decisions we can to keep schools open safely and to reduce the risk of transmission of the virus within schools. We are not planning to introduce this guidance that we are introducing as of Monday for secondary schools and primary schools, and I hope we don't have to do that. But equally, you know, anybody in my position who stands up here and says categorically I will absolutely rule something out, if I later get advice saying it would be actually for the protection of children to do it, I don't think any parent would thank me for that. The World Health Organization has issued guidance that, you know, is reflected in what we're seeing right now. None of this is easy, none of this is desirable for any of us, but we are not living in normal times, and we're taking these decisions with the best of intentions to try to reduce the transmission of this virus as much as possible. And lastly today, Terry Murden from Daily Business.
Hello there, yes. Just coming back on Tim Baxhall's point on the economy. There's clearly growing anxiety about government funding coming to an end. Notwithstanding your views on borrowing powers, is there any scope at all for reassigning part of the Scottish National Investment Bank's £2 billion budget towards helping businesses that require immediate support?
Well, the £2 billion capitalisation of the National Investment Bank is over a period of years, and the National Investment Bank is for patient capital for the long-term strategic projects that we need to make the transition to net zero, for example. So we will look at all aspects of our budget to try to maximise the amount of support we can give to companies now and to extend that for as long as possible. But, you know, whatever things we try to do to flex that, we will always come up against the fact that we have a largely finite budget and we don't have no borrowing powers, but we have very limited borrowing power. So it's not just a view that says if we are going to be able to do more, we either need more resource in the form of consequential funding or we need greater ability to borrow. That is a statement of fact. And that's why we continue to very constructively, I hope, make these arguments to the UK government, because I think we all want to see companies given as much support as possible. But I'll repeat the point I made earlier on, because I think it's becoming urgent, and there are more and more voices echoing this, that the furlough scheme should not be withdrawn prematurely, even if it is changed to be more sectoral focused, but just withdrawing it, I think, is a big mistake, and I hope the UK government will rethink that. That concludes our questions for today. Thanks to everybody for joining us. Thanks to the Chief Medical Officer and to Anna, our BSL interpreter today, and thank you to all of you. Please continue to follow all of the facts advice, and please tell everybody you know to follow all of the facts advice. And I will join you tomorrow, not from this podium, but from the Scottish Parliament, I think at the earlier time of the slightly later time of 12:20, when I'll give the statistical update, and then there will be the weekly session of First Minister's questions. So I hope you can join us then. But in the meantime, thank you for joining us today.